Hello everyone and welcome to the show. I welcome you today to the today's session on male infertility by Apollo Fertility. To speak on this topic today, I would like to welcome our Dr. Shweta Gupta. She's an in-house fertility consultant with Lajpat Nagar Delhi Center. And as you all know, I would like to give a brief background about the doctor. About her educational qualification. Our doctor has done she's a gynecologist and obstetrician from Delhi University. She has done her MRCOG and FRCOG from London University. She has done her post graduation in reproduction from Bristol and fellowship in reproductive medicine and art from London University. So we have someone who is well known and well educated and who knows the topic in and out. Even in fact, today's topic is quite interesting. So we always talked about female problems, but very rarely anyone really talks or touch upon this topic. And we would want to know more about it from Dr. Shweta Gupta. Ma'am, it's all yours. We're very eager to hear on this topic from you.
Thank you, Aarti. Thank you for your kind introduction. And of course, it's a very interesting and I think very relevant topic, male infertility, because even though the with the society and with the everyone believe that it's primarily a women problem, but it is not so. About 40 to 50% of the patients when we see, we get to find a problem which is related with the male. So, to begin with, how we define infertility. Infertility is something, when a couple has been trying naturally for a baby for a year. And of course, in case of male infertility, we often see that in 1 in 6 or 1 in 7 couples, we find that infertility is present. And in about 30 to 40% of the patients, we may have a male exclusively problem or may have a joint problem where both male and female are response are there is a cause which is contributing to the subfertility. So, how do we, diagnose male infertility? So, if a couple comes, of course, when we take a history to a lady, similarly we take a history for a man also, and sometimes some factors like medical history or some, past operations of the in men suggest that there may be a possibility of a male factor also. So, a good medical history, and of course, examination, and then thereafter a test. So tests are very important because in some cases there may not be any medical history suggestive of male factor. And when we do the test, the semen analysis is the most important test, which gives us an idea whether there is any sperm or whether there isn't any sperm, and if there are sperms, then what is their count, what is their motility, and how they are looking. So the WHO has given a criteria or a range where we say that in a normal range, this is the count should be more than 50 million. There should be some good motility, and also the look wise, the morphology should be 4%. So these criteria which we have, we look into these aspects. And so the problems can be from no sperms, that what we label as azoospermia, to the problems like the low motility or low count, or the morphology, or the shape of the sperms not up to what we define as a normal. So, and there can be problems in all the three parameters. So, this is one of the basic tests, semen analysis, and which we like to do it in our IVF clinics, and we ask our andrologist to have an immediate look into it and give a report. So, once we know that there is a problem, then we may have a second series of tests, which may be a hormonal profile of the male, which may be, sometimes we get an ultrasound and we look into the testes, whether the testis is the place where the sperms are formed, whether that is functioning normal, whether there are any, the blood flow is normal or not, whether the hormonal profile is okay or not for the man. And also, if required, sometimes we do more testing, like a genetic testing, karyotyping, we may have to do an infection screen, or whatever the history suggests. So these are the tests which help us to diagnose. Yes, there can be some male factor. And along with the male, of course, whenever a couple comes, we simultaneously have to look into the female aspect. So her basic testing has to be done, because there can be two problems together. Now, when we have made a diagnosis of the subfertility due to the male factor, then depending upon what we find, what the diagnosis is, or what type of what is the cause of male factors subfertility, we decide the treatment. Now, the treatment can vary from there can be different type of treatment depending upon what we find in the semen report. So if there is, so let's take the one first scenario, that there are no sperms at all. So the patient has come, we have taken a complete history, and they're both okay. There is no problem in the the history, medical history, but on a routine semen analysis, we haven't been able to see any sperm. So then in that case, we may ask the patient to take another, give us another sample, just to do the complete, to just to double check it, and then we label it as a spermia. And now we do second series of tests where we find out what is the cause of no sperm. Now there are two types of causes. One is where the sperm formation is problematic. So the sperms are not able to form. And in another second category, which is which is obstructive azoospermia, where the sperms are formed. So the formation of sperms are normal, but they're not able to come out in the semen. So that means that maybe in the tube, or there is an obstruction. So, if that is so, if there is a good sperm formation, but it's not able to come out in the semen, then then in that case we have a very the options like TISA, or where we take the with the help of needle, we directly aspirate the sperms from the testes and we use it. Now when we aspirate and use it, now we cannot we have to do IVF. We have to do take out the women, we have to stimulate the lady, and we have to take out the eggs in the lab. We use a technology which is called ICSI, that's the intracytoplasmic sperm injection, and where each sperm is picked up by the embryologist after the selection and is injected into the egg. So the sperm which we have taken out from the aspiration in cases of azoospermia has to be injected. So a couple will require IVF, and in the IVF, ICSI along with the sperm aspiration. So ICSI is a technique which has actually revolutionized the male factor infertility. Even if the sperms are present, but the count or the motility or the movement of the sperm, or there are lots of abnormal looking sperms, then also we use this technique which is called ICSI, where we in the lab, the sperms are selected under the microscope and with all the magnification, and the best sperm is picked up by the embryologist and is injected into the egg. So the fertilization which has not been able to be, which because of the some parameters which were not normal in the semen, is not happening normally. With the help of assisted technology, we are able to overcome that problem. So then the couple with the same sperm, which is suboptimal semen analysis, we can have the pregnancy with their own egg and sperm. So ICSI is a technique where we use in the male factor subfertility. Uh, Now there can be that there is a problem with the sperm production. Then of course we have to analyze more in detail. What is the reason? Whether the patient requires any genetic testing, whether the patient requires any hormonal profile testing, whether we need to some supplement or give some treatment before we go ahead with the teaser, or in some cases we have to do the micro teaser, because There's only occasional sperms are present, and those sperms will require really, a lot of hard work in the lab, that you have to pick up those sperms and inject it into the egg. So, of course, it depends upon what type of semen analysis report is, and depending upon that, your fertility specialist will guide you which is the most appropriate. If it's only minor problem, it's, or if say some problem like ejaculatory dysfunction, or little milder form of sub optimal semen report, then we can even have something much simpler like IUI, that is intrauterine insemination, which is done after the sperm preparation techniques. So from one hand, we can have something like IUI to IVF ICSI, and along with that, teaser or micro teaser. So depending upon what we have, the report, we decide on the treatment. uh, Now, so whenever any couple which who feels that there is some particular history where the male can have a problem, whether the patient had some kind of infection of sexually transmitted disease, or some kind of operations already operated person, or the patient is on a long term medication, I think some they should actually, rather waiting too long, they should come to the fertility specialist and get themselves checked and evaluated, because there is a possibility that sometimes when you are on steroids or on your testosterone or on some medication which can have a effect on your semen count, or if you have a long standing diabetes, even that can have retrograde ejaculation. That means the sperms are, instead of coming out in the semen, they are going into the bladder. So all this will make you problems in conceiving, and can sort of delay in, in your this thing, in getting you pregnant. So, because few things cannot be modified as a couple, but there are few things which is, in the hands of couple, where you can have a good lifestyle, like too much alcohol can affect the count and motility, or if there is, you are on anabolic steroids and you like to go to the gym and build up, so these steroids can actually harm your sperms. So good, normal BMI, healthy lifestyle, and though the age has more effect on the females, but not too, one shouldn't leave it too long, even for male. Somewhere the and also the obesity, too much, the weight should be normal. Healthy lifestyle, avoid steroids or anything like that. Too much smoking should be avoided. Caffeine also limited is okay, coffee, but too much caffeine, smoking, drinking, so they can also affect. The other thing which we have seen in this modern ID technology is, IT world is too much of this laptop. So laptop, if you actually keep it on lab, it raises the temperature, local temperature, and it can the battery on the bottom, it gets too and keeps it gets too warm and increases the temperature, which can have affect the male. So if you have to use long-term computers, it should be kept on a table, so that it doesn't increase the local temperature. So similarly, like if you have hot tub bath, that can affect your testes. Too much phone, it's still not very completely evidence based, but too much electromagnetic rays, there are some studies says, but of course we have to wait for a more evidence, can affect the sperms. Any infection, any chronic infection long term, can affect transiently your sperm formation. So in that way, it is best to wait for some time and repeat your semen test. Now, if there is a case where there is some minor, defects in the sperms, and which your doctor may put you on some kind of antioxidants or medicines, which has a lot of zinc, selenium, and or medicines like CoQ, which can actually help the sperm quality and motility. But one must remember that they take time to help. So when if you're on medication, you should wait about 3 months, because the whole cycle of sperm formation is a bit longer. So to have any effect of this, medicines, one has to use it for a little longer time. So about 3 or just under the 3, we recommend that one should have these medications, and then see whether they then repeat the semen analysis and see whether there is any change, or one has to go for some kind of ART procedures, as I discussed, from simple medicines, then to go on to the IUI or IVF with ICSI, or sometimes with micro TZ. So there is one question: for the first time, um, should we go on to andrologist or IVF consultant? Well, I feel, if clearly you have a history which you know that you can have a problem, like if you had some kind of infections, mumps, or in the past sexually transmitted disease, you have a pain in the testes, there can be something like varicocele, or sometimes a tumor is there. So then in that case, of course, it's okay to go with urologist or andrologist. But so it actually doesn't matter even if you come, but for a if you want a baby, then even if you come to any IVF consultant or fertility specialist, so for initial checkup you can visit anyone. Even as a fertility specialist, they will have a checkup, and if required they may refer to the urologist also if there is another any problem like hydrocele or varicocele, or they expect any suspect any tumor. But rather than just sitting, it's a time when you come to the doctor sooner rather than keeping it late. So the irony is that sometimes the only the infertility, the patient, the male may not have any symptoms, and then so in just that they're having difficulty in conceiving. So in that case also, the semen analysis is very important, because even if the count is low or motility is low, the man may not have any symptoms. So proper evaluation is of course required. Now there's another question that too much traveling on a bike. So exercise is not bad, but too much is, or if can have effect. Too much means like, sometimes the guys, they like to develop the body, and they may take some kind of steroids and anabolic steroids, which not knowingly can affect the sperm count. So one should not be too much getting carried away that okay, all those powders and these steroids can have effect on their sperm. So one should be only doing moderate exercise and with a very realistic way forward. So that was the one question. Any So the question is, what is the most important thing I should know about male infertility? I think if you are asking only, most important one, the important thing is that awareness and that thought process should be there, that if you and your partner is having a problem in conceiving, just don't send her alone only, come with her. It's actually a joint treatment, joint evaluation, jointly they both should be evaluated. So it is possible that the lady is fine, only the man has, or it is possible that both of them have a problem, or a lady may have. So it is very important to get man also should get checked, and an appropriate treatment can be formulated after evaluating both. Because I have seen so many patients that they had some problem. They've got semen analysis done, and there was a problem. They were on medication, and they probably not discussed this at home, and the wife was never brought for clinic, for complete evaluation, because somehow they got themselves evaluated and they had this report with a minimal or zero azoospermia or a low sperm count. And after many years, they came with wife, and then to your surprise, I mean, to their surprise, you finally tell them that, oh, now the egg is also gone. So it's important that both of them come, because egg is very much related with the age. So when we are talking about the success rate, it is both very important, the sperm is as well as egg. Another question is how to manage psychological mindset when male infertility is a cause. So yes, this is actually what is this kind of thought process is, I think, coming from the social, what we always feel that, or what is there in India is that it's primarily a women's problem. No, it can be women, it can be men, it can be together, it can be sometimes unexplained in 15-20%, where we are not able to find out the cause. So in all these cases, we need to have a complete evaluation and formulate a treatment plan. The good thing is, a lot of male infertility patients should know that there are treatment options available. There had been a lot of advances, and the treatment with their own sperm is also possible. Of course, there are very few selected cases where there are still, we need more research. But in majority of the cases, especially with the ICSI technology, we have been able to give them their baby. So it is time when they shouldn't feel too much stressed about it, and they should just come to the doctors and get themselves evaluated and treated. And I think that is all, unless Aarti, we have any question.
No, ma'am, we can actually, if you are done with the session, we can conclude with a final message.
Yeah. So I think I've finished, unless there are any other questions. Um, I think that is all for today. Thank you very much.
Thank you. Thank you so much, ma'am.
Mm.
Thank you so much. It was wonderful listening to you. There were a lot of, I would say, doubts which got cleared. So thank you so much, ma'am.
Okay. All right. Thank you. Bye.
Bye. Bye.